So what do I tell 663,000 people in 2 years or 3 years when President Trump breaks his promise by pushing them off of Medicaid because the funding's not there anymore, guys? But I'm telling the president that you have been misinformed. You supporting the Senate mark will hurt people who are eligible and qualified for Medicaid.
That is Senator Thom Tillis, a Republican from the swing state of North Carolina, railing on President Trump's big, beautiful bill last night on the Senate floor. Now, Senator Tillis brings up two important issues I want to talk about in this video. The first is the timing of when these cuts to Medicaid and the Affordable Care Act will kick in. And the other is who will actually be cut from these health insurance programs. Is it just illegals and fraudsters or able-bodied people who just refuse to work? Or will it actually be Americans who are actually qualified and eligible for these programs, as Senator Tillis suggested? Now, before I tackle those things, you should know that the White House and President Trump have both said Tillis is wrong in his assessment. Of course, Trump threatened to primary Senator Tillis because Tillis is a no on this bill. Tillis responded to Trump by saying he's not going to run for re-election because he refuses to vote yes on this bill. So you can decide who you want to believe. The other thing you need to understand is senators are still in the middle of a Voterama, and then there has to be a final Senate vote. And then, of course, this bill will have to go back to the House for another vote in order for the big, beautiful bill to pass. So things could absolutely still change. But based on what we know so far, let's talk about who will be impacted by these Medicaid cuts and cuts to federal subsidies for your Affordable Care Act health insurance. As I reported in this video yesterday, according to the Nonpartisan Congressional Budget Office, almost 12 million people will lose their health care coverage because of this Senate version of the bill over the next 10 years. Who are they? The CBO report said of that nearly 12 million people, the Senate version would take health insurance from 1.4 million people without verified citizenship, nationality, or satisfactory immigration status who are currently qualified for state-only funded programs. That leaves 10.4 million Americans who are currently eligible who will see their Medicaid benefits stripped or will lose their Affordable Care Act health insurance because the federal subsidy that they've been getting for that health insurance is gone. Now, could some of those people be fraudsters or able-bodied people who just refuse to work and are just getting a free federal government insurance ride? Sure. It's unlikely, though, that 10.4 million people are in that bucket. What's more likely is we're going to see a large percentage of people who are currently eligible and are among the working poor lose their benefits as a result of all of this. Now, it's not just your Medicaid insurance and your ACA subsidies that are being cut. These cuts could also force rural hospitals and community health care centers to close. So even if you do have health insurance, but you don't have anywhere to go to be treated, that will also impact you, and that is not accounted for in those numbers I just talked about. So when is all of this going to happen? Well, it depends on what specific cut you're talking about. But according to the latest Senate version of the big, beautiful bill, the cuts to Medicaid for individuals and states begins on October 1st of 2028. The new work requirements for individuals begins after December 31st of 2026. P.S. The bill also gives your state the ability to start to require those work requirements sooner if your state lawmakers want to go that route. After December 31st of 2026, states will also have to start conducting eligibility redeterminations every 6 months for certain recipients, including low-income adults, those with disabilities, and chronic conditions. As for the federal subsidies for your Affordable Care Act health insurance, starting after December 31st of 2025, the big, beautiful bill says there will be new limitations on who can qualify for a federal subsidy during certain special enrollment periods, and you will have to go through a much stricter eligibility process. Then, starting in fiscal year 2027, the federal government will start reducing the funding to states for the cost sharing of payments to insurers through the ACA, and will reduce funding for the basic health program, which states use to cover low-income Americans. Without that federal funding, most states will not be able to pick up those costs, so states will most likely be forced to cut the number of people who can get a subsidy for health insurance. Of course, without those subsidies, lots of Americans simply will not be able to afford health insurance at all.